What is the most appropriate management for this patient? Looks like ophtho stuff. 72-year-old woman presents to ophtho clinic, 6-month history of gradually worsening vision in both eyes. No history of trauma or surgery, difficulty reading, recognizing faces. Medical history includes hypertension, hyperlipidemia. Fundoscopic exam reveals drusen and retinal pigment epithelial changes in both eyes. No evidence of neovascularization. Appropriate management for this patient. So it sounds like pigment epithelial changes in both eyes. So it sounds like she's having like vision, or I guess these pigment changes, maybe secondary to her hypertension or hyperlipidemia. So I guess we need to think about how to, well, like I don't think we need to just observe. She's like losing her vision. So we need to figure out like, to be honest, I don't know what drusen pigment changes is or are. So, okay. So anti-VEGF is like the endothelial growth factor, but we're not having neovascularization. So I wouldn't think that one. Laser photocoagulation, I'm unsure of. Oral antioxidant and zinc supplementation, I don't know if that's enough at this point to like stop the process we have. And I don't think observation only. So I'm in between laser and photodynamic therapy. And I don't really know, I guess what either is indicated for, or like which would be best to use. Let me think. Hypertension, hyperlipidemia, drusen retinal pigment, both eyes, no evidence.
So what's your gut say?
I might just say, I think photodynamic therapy.
All right, so let's talk about this, right? So first, this is age-related macular degeneration. Okay.
Okay.
They always mention like the drusen, the retinal pigment, epithelial changes. Those are all macular degeneration.
Okay.
Okay. But age-related eye disease study, right, has shown that oral antioxidant zinc can slow the progression of AMD with patients with intermediate advance without choroidal neovascularization. So, age-related macular degeneration with right neovascularization is exactly what you're saying with the anti-VEGF, right? Because you want to decrease the amount of blood, the new blood vessels are being created, right? Photolaser coag is an older treatment for neovascular, right, AMD. But now it's been replaced. Photodynamic therapy is also a neovascular AMD, and then observation is not appropriate, right? Because there's some good evidence with zinc and antioxidants. So I think the treatments here, this is a little tricky, and I think this is in a sense might be a little bit difficult for step 2, I would say. But most of the more invasive treatments are dealing with the neovascularization, right?
Okay.
So if there's not neovascularization, age degenerated macular degeneration, then you want to do something like antioxidants and zinc supplementation.
Yeah. So basically we're not doing photodynamic or photocoagulation, even if it is the neovascularization. We'd start with the anti-VEGF.
Yeah, this is going to be your gold standard, it seems like. So
Okay. And then if it's non-wet or non-neovascularization, that's when we'll do the antioxidant and zinc. But we
yes,
can't really, it just slows the process, not reverses it.
yeah, not reverses it. Yeah.
Okay. Alrighty. No, that's helpful. Thank you.